Welcome to part 5 of the Nutrition Essentials class. My name is Keely and I'm a dietitian here at the Toronto Western Hospital Bariatric Surgery Program. In this module, we will be using the Bariatric Scorecard to assess how you are doing with your eating now, and using this to help you to set some goals moving forward. Goal setting and making lifestyle changes are very important in order to demonstrate your readiness to make changes to your diet for life, to qualify for surgery, to start to improve your overall health right now, and to improve your chances of successful weight loss long term. It is important to start with goal setting now as we expect patients to eat a healthy diet prior to having surgery. Research has shown that patients who start to change their diet before surgery are more successful with losing weight, achieving desired health outcomes, and maintaining these outcomes than those who don't. In order to explore your eating habits further, we have developed what we call the bariatric scorecard. This was included in the email that was sent to you. It will help you to look back at your eating habits over the past 2 weeks and identify areas for dietary improvements before proceeding with bariatric surgery. This is what the bariatric scorecard that you received in your email looks like. Please circle the number in the column heading that best represents your behavior over the past 2 weeks. Feel free to pause this recording to complete this sheet. The statements numbered 1 to 9 describe behaviors that help to maintain weight loss long term. On the other hand, the statements numbered 10 to 14 describe behaviors that may impede weight loss and weight maintenance. We recommend that you look at the scorecard later to identify areas for improvement and set some nutrition goals to work towards before going for surgery. We're now going to set some goals based on the bariatric scorecard results. You also have several months before surgery, so in the meantime, we want you to eat in a way that will improve various health conditions, such as diabetes and high blood pressure, also known as hypertension, in order to reduce your risk associated with surgery. Let's go back to your bariatric scorecard so that you can establish some goals. Look at the areas that you have scored 0 or 1 in and use these to create your goals. Pictured here is another document that you were emailed. We would like you to use this to write 3 goals to work on prior to meeting with us. It is very important to ensure that your goals are realistic, measurable if needed, attainable, and also specific, and make sure that you give yourself a timeline. Here's an example of how to develop a goal and to fill out your action plan document. Here we have Jimmy. Jimmy's goal is to eat more vegetables and fruit. He will start next Monday after he goes grocery shopping. What will make this difficult? Jimmy has identified that the time to wash, cut, and prepare vegetables or fruit at mealtime as one of his barriers. How will I make it easier? Jimmy will buy some pre-washed and cut and/or frozen vegetables or fruit for convenience so he can include them in his meals and snacks. So here Jimmy is very specific about what he would like to achieve. He also has set himself a very realistic timeline to start working on this goal. By using strategies like buying pre-washed or pre-cut veggies and fruit and canned or frozen veggies and fruit, he has made the goal of increasing vegetable and fruit intake much easier to attain. Another example of a common goal we see our patients making is to start eating breakfast. Again, we can set it to start on the day after grocery shopping to make it more realistic. What would make it difficult? Not having time in the morning to prepare breakfast or not feeling hungry are oftentimes the most common barriers. In order to make this easier, we can prepare a light breakfast the night before, for example, a small container of Greek yogurt with a piece of fruit or a couple boiled eggs with a piece of fruit. In order to make this goal much more realistic, we can aim to start having breakfast 2 to 3 times weekly instead of daily. And eventually, the goal is to eat breakfast every day. This concludes the 5th nutrition module. Please now proceed to the 6th module titled Getting Ready for Your Nutrition Appointment. Thank you.